Body Fluids and Circulation, Session 13. In this module, we are going to learn about the disorders of the circulatory system. Let us learn about the circulatory disorder, hypertension. Most heart problems are related to variation in blood pressure or BP. During circulation, when the heart pumps blood, the blood rushes through blood vessels and exerts pressure on the walls of the blood vessels. This is called as BP or blood pressure. The heart undergoes alternate systole and diastole, and hence blood pressure is measured as systolic or pumping pressure or diastolic or resting pressure. Blood pressure is measured using the instrument Sphygmomanometer. It measures blood pressure in millimeters of mercury or mmHg. Healthy individual has systolic to diastolic pressure of 120 over 180 mm of mercury. When BP is 100 over 50 mmHg or less, it is called as low BP or hypotension. Similarly, when it is 140 over 90 or more, it is high BP or hypertension. Thus, any change in BP leads to coronary heart disease. Hypertension is caused when the blood pressure is higher than the normal range. The normal blood pressure is 120 over 80 mm of Hg, where 120 mm Hg is the systolic pressure, whereas 80 mm of mercury is the diastolic pressure. When the blood pressure rises over 140 over 90 mm of mercury, it indicates hypertension. And higher blood pressure always has the risk of coronary heart disease. The coronary heart disease is also called as arteriosclerosis. This disease is characterized by the narrowing of the lumen of the arteries due to deposition of calcium, fat, cholesterol, and fibrous tissue. And this deposition affects the blood supply to the heart muscles. Let us learn about the next disorder, angina. It is also called as angina pectoris, which is characterized by acute chest pain due to insufficient oxygen supply to the heart muscles. Coronary artery disease or CAD affects the coronary circulation of the heart. Calcium, fats, and cholesterol together accumulate and form plaque in the coronary arteries and decreases flow of blood to the heart. This accumulation of plaque is called as arteriosclerosis. Symptoms of CAD include angina, heart attack, cardiac arrest, and heart failure. Angina is severe chest pain due to reduction of supply of blood to an area of heart muscles. Whereas heart attack results when there is a blockage of the blood supply to the heart muscle causing the patient's death. Cardiac arrest is a sudden stopping of pumping of the heart due to the failure of contraction of heart. In contrast to cardiac arrest, heart failure is the inability of heart to pump blood to meet the body's demand. It results in accumulation of body fluids resulting in swelling of legs and ankles and also congestion of lungs. Hence, it is called as congestive heart failure. Hence, cardiac activity should be well regulated and any deviation may lead to heart diseases. Now let us revise what we have learned. Hypertension, the first circulatory disorder we learned, is due to an increase in the normal pressure, that is 140 over 90 mm of Hg, which can lead to CAD or coronary artery disease. Coronary artery disease is otherwise called as arteriosclerosis, which is caused due to narrowing of the lumen of the arteries due to deposition of calcium, fat, and cholesterol. It has various symptoms. The first is angina. Angina is an acute chest pain due to insufficient oxygen reaching the heart muscles. Second is heart attack, which results when there is a blockage of blood supply to the heart muscles, leading to the patient's death. Third is cardiac arrest. It is a sudden stopping of the heart due to failure of contraction of the heart. And last is heart failure, inability of the heart to pump blood to meet the body's demands. It results in accumulation of body fluids, leading to swelling of legs, ankles, and also congestion of lungs. Hence, it is called as congestive heart failure. So, dear children, in this module, we have learned about the different disorders of the circulatory pathways. Thank you.